Your birth plan, pain management, medical interventions, and natural pain relief. Your birth experience matters, and having a solid birth plan can help you feel more confident, prepared, and in control. But what should it include? Today, we're going to break down the key decisions you'll need to make when it comes to pain management, medical interventions like Pitocin, and natural pain relief options. Hi, I'm Stephanie, aka the Healthy Practitioner, board-certified family nurse practitioner specializing in integrative medicine. I've helped hundreds of women regulate their hormones, create birth plans that are advantageous to them, and live really healthy lives. Okay, so let's dive in. So I'm really excited to record this one because my girlfriend just had her 4th baby this morning, and it was a natural, unmedicated birth, and this was something that she's had a goal for many years. So she's had her 4 kiddos, all within the span of a handful of years, and with her first pregnancy, she was scared, right? I mean, what you see on the Kardashians and really just television, you just see this experience that will be severely painful and whatever. People just kind of go with what their doctor says and they'll get their epidurals. And each pregnancy, though, she was like getting a little more confident. Like, I don't want this or this. And by this time around, she's like, last time I went to the hospital, they put an epidural in me in the last couple minutes and it didn't even kick in by the time I delivered the baby. So this time, I don't want anything. And I want to be able to say I had a pain-free, intervention-free birth. And that's what happened. So I just get all giddy about this because with my own home birth experience, no interventions, I knew that was something possible for me. And I know that's possible for a lot of women. Again, we just get told that it's going to be one way. And, for me, we can either look at pain, like these waves that come in of contractions, as being one step closer to meeting this human that we are birthing, or it can be considered something like extreme. So anyways, there's a lot of mindset in it. I did a lot of hypnotherapy before my birth. But either way, when I had my birth plan, I had 3 birth plans. I had my home birth plan, my hospital birth plan, and a C-section plan. And I can dive into that more later. But, the C-section was because I had a history of severe Crohn's and it was a potential. I've had my belly cut open before. And there was something that kind of kept getting me throughout the pregnancy of maybe a fear. And what someone told me was grab your favorite beverage, get in a bathtub, and journal. What is the cause of that fear? And for me, I'm like, okay, I want to do this. I went and I started thinking about it. I'm like, well, I'm not afraid of getting cut open. I've been cut open plenty of times. And it ended up being that I was afraid that my baby was going to be taken away from me without Alex being around and maybe having medical interventions that I didn't want, which I know there's a very low risk, but there's just that fear in me, right? And so I talked to Alex, my partner, about it, and I'm like, if something happens, you promise me that you will not leave the baby's side. You're going to go wherever that baby is. And he promised that. And when I saw it in his eyes that he was this, I'm the mama bear, right? So sometimes I take over that role and he's just like, I'll just go with the flow. But I was like, you need to promise me. And when I saw that he was going to promise me, then I could relax. And then I went on to have a really amazing home birth. So just, a reminder that a home birth is not set in stone. I know some people when you go to a hospital in a birthing center, those nurses will make fun of a birth plan. And what they're joking about is that sometimes we have unrealistic expectations of what a birth outcome should look like. And if we don't have that outcome, then there can be a lot of depression and it can lead to a lot of different things. And so I think that they're more just worried about it not going as you plan, because birth takes 2 to tango. And so what your expectation is, even if you performed the exact way that you wrote it, that baby is still a part of this team and you don't know what to expect from them. So you just have to keep an open mind when you're going into your birth and with a plan. What I love about planning is that you, at least when you're pregnant, you can have some expectations and things won't throw you off as much. If you are educated and you know what they potentially do at the hospital or at home or wherever you're going to be giving birth in, then you can ask the right questions and you can be like, oh, I already read about group B strep and this is how I want to do that. Oh, I read about the vitamin K shot and this is what I do or do not want. And so anyways, it just makes you more informed going forward. So let's talk about pain management options and risks. So you know me, I'm going to way more on the risk side because you're just told to go in there and pop an epidural in and have this baby. But there are risks associated with that. And unfortunately, I'm the person in this integrative space that people come to me when they have side effects from these drugs, and I have to help them navigate it. So let's talk about epidurals, because that's regional anesthesia. They put a spinal injection in that numbs the lower half of the body. The side effects for mom can be a drop in blood pressure, cause dizziness, nausea, or fetal distress. It can increase the duration of labor, which usually signals an intervention train. When you hear that, that means that, okay, the mom had an epidural, now they have to have Pitocin, a synthetic form of hormone to help contractions. Well, synthetic is never better than normal in anything, whether it be supplementation or anything. The real stuff's always the best. So when you start this intervention train and you give Pitocin, we'll talk about that later, you can have increased risk for C-sections and all of that. So it just increases your risk for going on that, all of a sudden starting getting more interventions. You're at higher risk for forceps and vacuum use and C-section. And then it reduces the urge to push, which requires more intervention. And then you have limited mobility. So even if you jumped up all of those birthing positions that you want to do, being on your hands and knees, which is a really amazing one, sometimes you're limited when you have an epidural. For baby, they can have a drop in heart rate and decrease their oxygen supply. They can be drowsy and experience latching issues at birth. And at the end of the day, sometimes epidurals don't even work when they're in. Second, there's IV fentanyl. Fentanyl is an opioid pain medication. It's usually given through an IV, and it's short-acting to reduce the pain perception. So for moms, it can cause extreme tiredness, dizziness, vomiting. It doesn't take away the pain, it just takes the edge off. And then it could require oxygen support as well. And for baby, fentanyl does pass the placenta, so it can make the baby drowsy, slow to breathe, or need NICU support, and typically lower APGAR scores, which is what they do when the baby is born. So babies can take longer to adjust post-birth with fentanyl. Fentanyl is not given close to delivery when you're over 7 centimeters dilated to prevent these major effects on the baby. Lastly, there's nitric oxide laughing gas inhaled through a mask that provides mild pain relief and relaxation. Some women can experience dizziness and nausea. I've heard this from so many women that have used it. They're like, I just was in so much pain and just wanted a hit of something. And they would do it, but then they'd be vomiting next door because it made them so sick. So it can provide slight edge off of the pain again, but also it comes with the nausea, vomiting potential. If you're in distress, you may struggle to breathe in deeply. So when you're further along and having more intense contractions, sometimes you can't get it into your body because you're not breathing deep. It doesn't accumulate in the baby system, but we don't know the long-term effects of that for babies. What I do know is that nitric oxide is super methyl scavenger. So B vitamins that you have in your body, it is ripping them out of you. Like, it is using them rapidly. And so I just tell people, if you're going to go in for any type of surgery or procedure, tell them that you are not able to have laughing gas because it does so much damage to your B vitamins. So if you did randomly have it, make sure you're really supporting yourself with high quality B vitamins. Pitocin. So as I mentioned earlier, Pitocin is a synthetic form of oxytocin used to induce labor or strengthen contractions. So the risk for mom is that Pitocin-induced contractions are stronger, longer, and closer together, increasing pain. I know that my sister had her first child, had an epidural, had Pitocin. She was on that train. She ended up having a vaginal delivery. But the second time around, she was like, I am going to have a natural birth. And she started having intense contractions, and she was getting to the hospital. She's like, Steph, I'm getting an epidural. I can't take this. Well, she was fearful because the first time she had these intense contractions with Pitocin, one, they were more intense, and two, they lasted 3 hours. And so she's like, I don't have enough energy or strength to be able to push the baby. Well, by the time she got to the hospital, it was too late to get epidural. So anyways, 3 pushes later, baby was out. And she's like, oh my gosh, I'm so glad I didn't get an epidural because I didn't know that it was going to be this easy. So a lot of times we think that like the epidural or Pitocin are an easy way out, but really they can cause more complications than that. So Pitocin can cause higher epidural rates because more contractions are intense. So then you have to get an epidural. So it's like either or, right? If you have an epidural, you typically have to get Pitocin. If you have Pitocin and you didn't have an epidural, you'd have to get that. Increased risk of uterine rupture can overstimulate the uterus, increasing risk for the rupture, especially in VBACs. And then a higher risk for C-section, as we mentioned. Stronger contractions can cause fetal distress, leading to emergency delivery. For the baby, intense contractions can change and decrease oxygen supply, causing distress, and increase NICU admissions. Babies born after after Pitocin-induced labors are more likely to have breathing issues. So if Pitocin is truly necessary, and sometimes it is, allowing the body to birth naturally can prevent complications. And again, this is not to make anybody feel bad. If you had Pitocin, if you've had epidurals, it is what it is. And I hope that you had your perfect dream birth, because at the end of the day, that's all I hope for with my patients. I don't want them to come to me with PTSD, anxiety, depression, because their idea of what they wanted didn't come true, or they have sustained effects from interventions that they had during birth. So what are some natural pain relief options? When I went into labor, I didn't know I was in labor. I didn't have a mucus plug break. I didn't have my water break until she was actually coming out. So I joke that I basically delivered a fishbowl, because that's what it felt like, right? When I started feeling some discomfort, I went into the shower and had hot water on my back for a half hour, and it was like a miracle. So water therapy, whether it be a birth pool, a shower, a tub, water can be your best friend in these situations. Breathing technique, the box breath, breathing in for 4, holding for 4, releasing for 4, holding for 4, and repeating that. Hypnobirthing, I suggest doing hypnobirthing. Start doing that a month or so beforehand and listen to it when you fall asleep in a happy mood, so that your subconscious can get attuned to what's going to happen. And then Lamaze breathing can be used as well. For some people, they prefer that. Movement and positioning, squatting, birth ball, side lying, hands on knees. Something that I learned during my pregnancy that I didn't know was keeping your knees in. So we think like spreading our legs out is the right way to go, but actually, so when you keep your knees touching each other, let's see, can I show you this? Camera. Okay, so you're going to keep your knees in. That opens up your pelvis. That actually helps the baby's head drop. Look at me. I'm a teacher by trade, okay? It helps move the baby's position down more into the pelvis. So keeping your legs out is actually closing that pelvis bowl. So you want to have your knees closer together, which feels awkward, but trust me, it works. Counter pressure and massage. A hip squeeze on the lower back provides pain relief during contraction. You as a woman know what feels good or what doesn't feel good to you. So again, this is why a birth plan is so good, because get your partner involved. If you're someone that really doesn't like to be touched or talked to when they're in pain, then make sure that your partner knows to not be gabbing during your pregnancy or during your birth. And then again, if you're someone that needs the affirmations and the love and the kisses, kissing, anything you can do that way releases oxytocin, which can help. So stimulating nipples, that kind of thing. So basically what got the baby into the body can get the baby out of the body just through the release of oxytocin. TENS unit can help as well. That's a transcutaneous electrical nerve stimulation device. So you'll see them, they give little sticky pads, and you can put that on the body as well. It just sends mild electrical impulses to help decrease pain sensation. And then one of my favorites was the comb method. So just a cheap comb, I'd put it right here, like the comb bristles, onto these acupressure points right here, and then close down. And when a contraction was coming on, I gripped in there, so it would put pressure here. And doing it to those acupressure points really took the pain relief off. From the first picture that I have of having contractions till having the baby, I had that comb in my hand the whole time, and I consider that one of my most important items, and it cost 99 cents. So anyways, your birth experience is going to be yours in all shapes and sizes. So whether you choose an epidural, Pitocin, or natural methods, being informed is the key to making the best decisions for you and your body. If you found this helpful, give it a thumbs up, subscribe for more pregnancy content. I'll be talking part 2 soon, which we talk about vitamin K shots, erythromycin, and other things post-birth that you might have questions about. Until next time, thanks for tuning in.